Hello guys, welcome back to Dragon Exotics, and as you can tell, I have Tsunami with me. Don't mind her, she's shedding. She's a bit dark right now. I'm in the garage filming, so she's just a bit cooler for this moment. As soon as she's done, she'll be back on her heat pad and under her heat lamp so that she can get all nice and warm. Fun fact, they do turn a darker color either when they're absorbing heat out in the sunlight or when they're a bit colder. So, the things you learn. Anyways, today's topic of the video, as you can see by the title, is talking about spaying iguanas. And this is a topic that, you don't find a lot of information about online, especially if you're just like searching for YouTube videos. And I know when I searched, I only saw probably one video of the surgery, and I'm like, oh, there's not a lot of information talking about this. So I'm just gonna share my experience and hopefully you guys take something away from it. If not, feel free to leave a comment. I don't mind. So we're gonna be talking about a few things in this video. The first thing I'd like to talk about is kind of what is an iguana spay, why you would do it, and the risks that can come with it. And then the next part, I'm going to kind of discuss Tsunami's experience, and I'm going to show you guys how to give her medications. So I'll leave out all the graphic images. Of course, I have plenty on my phone. It's the vet suit at mind. But if you're ever interested in those, I'd be happy to share. With further ado, let's get started. What is an iguana spay? You may be thinking, well, I got my cat spayed, or I got my dog spayed, and I know that that was to help prevent them from getting certain cancers in the future and help them keep healthy so that they can maybe live a longer life. And also population control. You don't want them breeding with other animals. But what about a lizard? Your lizard's not gonna go out and start breeding with others, causing an overpopulation of an invasive species. Scratch that. Don't release your animals into the wild, like in Florida, where they became an invasive species. We don't talk about that. But what is it? Okay, so an iguana spay is an ovariosalpingectomy, where they remove the ovaries as well as the oviduct. And if I were to describe these parts, well, I can't really put a picture in there because I don't want to gross you guys out. But imagine a bunch of little grapes, like maybe this, with a tiny little yellow dot in each of those spots, kind of joined together. That is the ovaries. Then we have the oviduct, which is kind of like a big fleshy piece of tissue, and when you expand it out, it looks like a little fan of fleshy tissue. Yeah, makes sense? Well, I hope so. Now, most people don't get their reptiles spayed, and that's just the fact of the matter. But there are times when you would want to do it. All right, so egg binding is unfortunately a common concern for lizard owners as well as bird owners. And in this case, we're talking about lizards, so let's talk about iguanas. So iguanas do not need a male to lay eggs. And depending on your iguana, they could start laying at 2 years or older, sometimes earlier. Each iguana can be different. Now, a typical clutch can be about 30 eggs or more, sometimes less, sometimes more. When Tsunami started laying, she started laying about 30 eggs a year, and then that jumped to 50, then to 60, and then to 70 eggs. 70 eggs? One clutch. Pretty crazy. So they can lay a lot of eggs, and even without a male. So when you get an iguana, it's important to know if you have a female, and then be prepared for those eggs. They need a specific nest box, as I had done in one of my previous videos on how to build a nest box. It has to be humid, it has to be warm, and it has to be somewhere where they feel comfortable digging and laying those eggs. Now, typically, most iguanas do well with this for a while, but then they can run into egg binding. Egg binding, or dystocia, is pretty much where they can't pass that egg. It could be that the egg is too big and won't fit through their cloaca, or it can be that it could have been poor husbandry. They weren't raised properly in the right humidity and temperature. It could be diet related, as I said, humidity, dehydration. There are so many causes, but one cause that can happen in, I guess, any lizard is over time as they age, which Tsunami just turned 8 years old. As they age, sometimes their body can't keep up with their reproductive tract. And that could mean that they just can't pass eggs like they used to. Now that brings us to kind of why we want to spay iguanas in the first place. So egg binding, as I said, if they can't pass that egg, things not so great will happen. So they typically start showing signs like being lethargic, they're not moving around, they're obviously swollen because they can't get those eggs out. And in some cases, they can die within 24 hours. Usually it takes several days for it to take an effect, but if an egg ruptures and there's not much you can do at that point. You have to get them in for emergency surgery, see what they can do. But egg binding can be pretty dangerous if they can't get that egg out. It's putting pressure on the body. It can lead to infection and peritonitis and other issues inside of the body, which can lead to their death. And so egg binding is important because if you're not watching your lizards, during their breeding season, you could find your lizard dead one day. I mean, if you're not watching closely. So you want to make sure that when they start passing eggs, that they pass those eggs in a timely manner and that you just watch them closely. Like Tsunami this past year, in the past 2 years, she's had some issues, but we'll get into that in a minute. But this past year, she laid 30 eggs, beautiful eggs. But then she still had eggs and she took over a week to lay the rest of those. I was watching her closely to make sure none had ruptured and nothing else was going on inside of her body because I don't want her to die. So you want to make sure you're looking for them being lethargic, like super distended, not moving, not wanting to eat during breeding season is pretty common. You can expect that for a few months. But definitely lethargic, not moving, and they show these signs really quickly. So if you see that, you want to get them checked out. Sometimes they can administer oxytocin to help push those eggs out. Tells the body, oh, this is what we're doing. Let's push those eggs out, and that could help them. But in other cases, they can't get to that in time, and they would need emergency surgery where they take the eggs out, and usually during that time they will spay the iguana as well. So in Tsunami's case, as I said, she just turned 8. She's getting a bit older, and the past 2 years she's been laying rotten eggs like this. And I thought maybe the first year it was just a weird one-time thing. I thought maybe because she was laying them in the pond, they might have just got all gross like that because there weren't a lot of them. But then this year she was laying, her first 30 were like beautiful, but then she laid a bunch of like rotten looking eggs afterwards. And so then I was like, well, she's been taking a lot longer to get the rest of her eggs out, and I don't want to risk her getting egg bound. So I made the decision to spay her. Now this, as I said, it is a good prevention for egg binding. And in the future, we don't have to worry about her laying eggs. So benefits could include not having to have that nest box. Oh my goodness. Not having to have, that nest box, or having to be crazy attentive during breeding season when you see that they laid that first egg. Typically they'll stop eating altogether when they have those eggs, so it may solve that problem partially. But overall, we're hoping to extend their lifespan with this because a lot of iguanas do end up dying of egg binding. So the purpose of this is to hopefully extend their lifespan. Now there are things that can get in the way of that, such as initial care during the early days, not having enough humidity, which can lead to kidney issues. So got to keep that in mind, but this is to prevent any of those reproductive issues in the future. Now, there are cons to the surgery. I mean, pros is obviously saving your iguana and helping them out long term, helping them feel better. But the cons is that the surgery is a bit risky. It's risky in all reptiles and birds and exotic animals in general. Going under anesthesia is a bit different than a dog or cat, and it takes them longer to wake up. And because that process is a bit different, sometimes they don't wake up, which I was a bit nervous. I've seen some of the surgeries done like before hers, and they've done really well. I mean, all the ones that I watched, they woke up. I didn't see any issues, but just knowing that there are risks in the back of my mind, they're like, oh my gosh, is she gonna wake up? So going into her experience was a little different. But that being said, the risks are definitely just with surgery. Will they wake up at the end? Are there gonna be complications? And then you wanna make sure you're going to a good exotic veterinarian, because the exotic veterinarian needs to be educated on how this goes. They need to make sure they know how to remove all of the ovaries, because if one of the little ovary follicles are left behind, it can grow back and then cause an issue. And then if it grows back, you're definitely gonna have to go into surgery with them. So make sure you have a nice educated doctor, and most of them are wonderful in exotic medicine. Just make sure you're going to someone who knows what they're doing. That's a key factor. And if they know what they're doing, then don't worry, surgery will go well. So here are the pros right here, cons right here. My personal belief is that I do think that you should get your iguana spayed if they're showing issues with their eggs. I wouldn't recommend a typical healthy young iguana go get spayed. I mean, if you have to, make sure they're mature so that everything is developed. But I think that just make sure you're monitoring your lizard, make sure that you know what's going on. And then if you feel that they need to be spayed, or if they're getting older and you're like, oh, it's about time, I should check on that, then by all means, get them spayed. See what you can do. But that's my take on it. Now, those of you who did decide to get your iguana spayed and are here because you're like, what the heck, I don't know what to expect for this visit. Well, I can help you out with that. So, first, you drive to the clinic, which for me was about an hour and a half drive, and you go in, you check in like everything else. They're gonna get a history, they're gonna make sure everything's the same. They may opt to do blood work during that visit, or they preferably try to get it a few days before the visit, so just know that ahead of time. You're going to want to go in, they're gonna want a regular physical exam, they're gonna probably get blood work during that exam, and then you'll come back the morning of the next day to typically drop them off. So I brought her in, and they put her in a nice little, how would you describe it? Like a little, not oxygen chamber, but a little enclosure. It's perfect. It's small, nice and heated, super comfortable, and there they'll probably wait for a few minutes. And I have a little video of Tsunami right here. So as you can see, she's just chilling. She's like, what is going on? And she's having a decent time. She's not too stressed out, so it's okay. So then they will start to sedate her, make her all sleepy, and that's usually a pretty quick process. It's a nice little injection, doesn't take very long, and once they get her all sleepy, then she is out of it. Once she's out of it, nice and unconscious, as you could say, they get everything prepped for surgery. Now, when they prep for surgery, they are getting all the sterile equipment out, they're getting the table ready, the anesthetic machine ready, everything is getting prepared. And so once all of that is prepared, they will move her into the surgery room, like shown here, and set her up. Now, in Tsunami's case, it was and extra experience. So I've had her for like 8 years now, right? And she's like never cut herself. But she decided on that day that as she was getting out of this cat carrier, she cut herself. She ripped one of her scales on the bottom of it. So you'll see in this picture that she has a little like red dot, kind of near her cloaca, but not necessarily down there, where she totally just ripped the scale off. Don't worry, it's healing fine. But I just thought I'd point that out there because you guys might be like, what the heck is that lesion there? And I'll be like, don't worry, she just did it literally minutes beforehand. She's crazy. These guys are crazy. So they got her on the table and they scrubbed her down to make sure she's clean. What are you doing? Scissors are crazy. And after they did that, they decided to do an incision. Now there are two types of incisions that they can do. One is on the midline of a reptile, and the other is kind of off to the side. I'm not going to use fancy vet terms because sometimes they're hard to understand. So they decided not to do it on the midline, which I like because there is a huge vessel running along the midline right here, right there, huge. And if they hit that, it can be dangerous and poses a risk during surgery to the iguana. So the clinic I went to, they are amazing. I love them. They, played it safe. They just went slightly to the side. There is no difference in where you make that incision, whether it's in the middle or to the side. So yeah, don't worry about that. So anyways, they made the incision to be able to see inside, find the ovaries. And when they make that incision, they decide if they need to extend it or just work with what they have. Now, her incision needed to be extended just a little bit so that they could find the ovaries. They were kind of buried underneath, so it took a little bit of time to find. And these are things that you need to plan for. If you're like worrying the whole time, you're like, oh no, my iguana's in surgery. What in the world is happening? Why are they taking so long? Why haven't they called me? Well, it could be that, they want to make sure they take their time to find the correct organs, locate where all the anatomy is so that they don't damage something that they're not supposed to. And her surgery took about an hour, hour and a half, and that's what you can expect once the surgery already starts. So they found the ovaries, and once they find the ovaries, which just picture like little grapes right here, they have to be careful of the adrenal gland. It's like a little peach colored thing and vessel running through. It's not a vessel, but maybe in your head you could picture that. Like a little line running right through. And so they have to be careful not to hit that because they don't want to damage the adrenal gland. So all this time they're being careful, they're finding the ovaries, they're getting that. And once they find the ovaries, they pull it up and they start adding these little hemoclips. And these are like, depending on where you go, I've seen bigger gold ones that kind of clip on, but the ones they used were like, they looked like the size, less than the size of a staple, like a little staple. And so they kind of grabbed them and pinched them on to start closing it off so that they can cut the ovaries off, safely, of course. So they'll do that, and then after they get the ovaries on one side and make sure they've gotten all the follicles removed, making sure that they're not caught up still in attached to any tissue, so then they'll move on to the oviduct. And the oviduct is that kind of pink, fan-like, stringy sort of tissue. I can't explain it to people, but they'll pull that out. And once they do that, they'll add a little suture to the middle of the suspensory ligament, and they'll start adding hemoclips so that they can cut it as far as they can so that they cut it off. Now, if they don't get all of that, typically it's okay if it's healthy. That doesn't grow back once it's cut off. So once they see if there's any pathology associated with the ovaries over the oviduct, they can better decide. But usually they'll cut it down as much as they can, and then that just stays how it is. It's hemoclipped, it's sutured, it's perfectly fine. So you don't have to worry about that as much. And the hemoclips are tiny. They're tiny, they look like stainless steel. They're good. They're safe. She has them. It was a fun surgery. So after they remove both ovaries and both oviducts, they will start closing the incision. Now in a dog or a cat, you can really kind of just do a nice little suture, bring it together. You're putting together separate layers, if that makes sense, so that it can all heal correctly. Well, lizards are a bit different. First, they have to find where the body wall attaches and then try to suture up that layer, as you can call it. And then they evert the scales so that they can make a different kind of suture. So as you can see here, try to put that there. This is about 2 days after surgery. If you see that, you can notice that they kind of flip the scales up so that the tissue, like on the inside of the scales, is touching each other. That allows for better healing. And so that's what they do in reptiles. They'll evert the scales to let it heal. Now, for the fun part, surgery's done. Yay! You have your ovaries and oviduct laying on the table. It's great. So, while the doctors are all cleaning up, getting stuff, getting their stuff done, they will make sure that she is disconnected from the anesthetic machine, and they will move her into her own little, not container, another little like enclosure that's super warm, super comfortable, towels, pillow, it's great. And when they do that, they're going to wait to see, how long it takes her to wake up. Once she starts waking up, they can pull the little endotracheal tube out, which I forgot to mention earlier. Yes, they do put a tube in their mouth. You can see in the picture that I sent earlier. But they'll pull that out once they start kind of waking up. And typically in reptiles, it can take anywhere from 10 minutes to 4 hours. In her case, she only took about like 20, well, right after surgery, it only took her like 5 to 10 minutes to kind of wake up to pull the tube out. And then she was pretty like well awake after about an hour. So I got to take her home within 2 to 3 hours after surgery. So it went pretty well. Some clinics may require typical clients to keep them overnight just because they want to make sure that they're healthy and they're not going to go through any emergencies while they're there. They just want to make sure they're keeping them as safe as possible. So that's pretty much just how the surgery went. 20 minutes of a surgery talk. Wow. But yeah, it really isn't that bad. They'll prescribe you some medications to take home, and I'll show you how to give them those medications in a moment. But I think it's an important surgery to know about and to consider if you have reptiles, especially reptiles that lay regularly and maybe reptiles that they just tend to have gross eggs. So it definitely would be something to consider, but that was my experience with it, and I hope that it helped any of you who are unsure of the procedure or who wanted more information. But feel free to message me or add anything in the comments if you have any questions, and I'll be happy to help you. I was there, I watched the whole surgery, I got to help with the surgery, so I should be able to help you guys out if you have any questions. All right, so in this part of the video, I'm gonna show you how to give medications to lizards. Now, in her case, these are her morning medications. Obviously, she needs them. Wow. Okay, so first, you wanna make sure you can hold the bottom of their head, especially if you have a nice lizard. Maybe different with aggressive lizards, you have to take a different approach, make sure you restrain them properly. But what I do is I grab the bottom and I just gently open it like that. Barely any pressure on the sides of her mouth. And right here, I have tramadol. Tramadol is a pain medication for after surgery. And so what I'm gonna do is I'm gonna stick it in there and give her a little bit at a time. Oh, she's gonna grab it, making sure that she's swallowing. Oh goodness. Ugh. Calm down. All right, pretty girl. Now, they may squirm a bit. Trying to do this like this is difficult. There we go. And that is tramadol. for the pain. She'll calm down soon. Tramadol does tend to have a kind of a sedation effect, so they might be a little bit sleepy after this medication. Maybe it'll help us with the video. Probably not. But biggest thing is making sure that her pain is under control and that she's not feeling that surgery site, because we did make an incision in her and messed around with all her organs and put it all back together. So that might be a little painful. So we want to keep her as happy and healthy as possible. And pain medication does a good job doing that. So next we have enrofloxacin. Enrofloxacin, as you can see here, is kind of weird color. Yeah, it's a bit brown, but this is the antibiotic. This will help her and make sure that we don't have bacteria setting in where it's not supposed to. So again, open the mouth from the bottom, and if they're not secure, let them readjust. I know, you're gonna knock everything out of proportion, aren't you? If you guys don't want a big squirmy lizard, don't get iguanas. But I love them, so it's great. Oh my goodness. Crocodile rolls, insaneness. Yeah. All right, let's get this next one in. We're gonna gently open the mouth, stick that in. Be careful of those teeth. Which, fun fact, iguanas do have plenty of teeth and a little bit oozed out. They have plenty of teeth, and when they injure them, they actually have new teeth that are growing in behind those to come in and replace them. Pretty cool. All right, that's 2 medications down. Wow, look at that. And that's just the stuff that kind of holds in the tip. So it's not like there's anything left that I can push out. That's just how it looks. The third medication is personally my favorite, and it is used a lot in the reptile world and you know, regular animal medicine world as well. This is meloxicam. Meloxicam is a non-steroidal anti-inflammatory to also help with that infection, so that infection doesn't set in the surgical site. So we're gonna put that in. This is gonna take a little bit longer to do because it's a bigger syringe. She doesn't wanna open her mouth. Come on, pretty girl. Sometimes you need 2 hands to get the grip and to hold it open. Now you have to be careful when you're giving medications to any animal, but in particular exotics, because when you're giving oral medications in lizards and birds, you don't want to risk them aspirating or the medication getting into their lungs, because that can be deadly, especially in small animals. So you really just have to be careful on that. It can be a big deal and can lead to the death of an animal within 24 hours. So depending on the animal, of course, some are more fragile than others. But that's why we're making sure she swallows before we add more and not giving too much at a time. There we are. 3 medications all done just like that. Tramadol, enrofloxacin, and meloxicam to keep her nice and happy during her little state of recovery. All right, thank you so much for watching today at Dragon Exotics, and I hope you learned something. Hopefully we can have some more videos coming out soon. And I guess I'll see you next time. Here are some fun clips, just for fun. All right, so now we're gonna check on her sutures. This is immediately after surgery. As you can see, she's kind of all in her defense pose. We're going to look under. That is the lovely suture. We're going to be keeping an eye on that to make sure we don't see any openings in it, any weird discharge, anything that really shouldn't be there, because if that opens, we don't want all of her organs to fall out, and that could not only be bad but also pose risk for infection and other issues. She's in a new environment, so of course she's going to be acting a little curious, a little defensive, a little territorial. So that explains her behavior here. She's been shedding like crazy, so got a lot of pieces of shed. A few nice ones, big one. But overall, she's looking good. And this is what we don't want her doing. Bye. Say bye, Tsunami. Oh my goodness.